Hold the 1112 Explorer with the modified pen grasp. To review, the instrument handle should be resting here against the side of your middle finger next to the fingernail. When you're exploring lightly, this finger may be relaxed. That's a relaxed modified pen grasp. But when you are applying a little more pressure to the tooth, you're going to straighten out that index finger and grasp the Explorer more firmly. You don't want to hold it with a really tight death grip of a grasp, because that will make it difficult to detect calculus. So sometimes you're going to be using a moderately firm grasp like this, and sometimes you may wish to relax it to get a lighter touch. This instrument, the Explorer handle, is going to rest here between these two joints most of the time. And then again on the anteriors, it's going to be up high, close to this joint. And when you get to the posterior areas, it's going to go down a little further. Usually you don't want to go past the bone on this part of your hand, though. So this is the modified pen grasp for the ODU 1112 Explorer.
The modified pen grasp that has been reviewed in the previous slide is applied to an assessment instrument as a probe or explorer. The same technique is used for scalars, universals, and Gracie instruments when calculus removal strokes are performed. Slight changes to the amount of pressure created by the thumb is initiated for calculus removal strokes. At no time is the thumb bent when applying a calculus removal stroke. It must be engaged and straightened. Let's review what not to do when holding a calculus removal instrument and applying a modified pen grasp. It is important to note that the handle rarely sits beyond the large knuckle of the index finger. This occurs when the instrument is held with the very tips of the fingers and not with the pads. The imbalance causes the index finger to ride up the handle and out of alignment with the thumb. The instrument will eventually fall into the web of the hand, causing the modified pen grasp to be unstable and the instrumentation to be ineffective. The thumb should not be bent to the point of flexion. Constant tension on the joint will flow through the wrist and lead to musculoskeletal disorders. Rolling is a movement that is performed between the pads of the index finger and thumb. This is a very small movement that is not more than 1/4 of an inch in length. The three most common areas that rolling is performed successfully are at the mesial line angles of posterior teeth when entering interproximal areas, or to redirect the tip after distal instrumentation is performed towards the mesial direction, and 3, across the facial and lingual surfaces of anterior teeth and into interproximal areas. The roll is activated while transitioning from distal orientation to a mesial direction. The instrument is rolled between the pads of the index finger and thumb to redirect the instrument. Rolling is not to be used for traveling across the buccal or lingual surfaces of posterior molars. This traveling movement is created by a rocking motion and changes in the fulcrum. Rolling can be performed across facial and lingual surfaces of anterior incisors and premolars. However, it is recommended to initiate a rotation or pivoting movement in the fulcrum to create the traveling across these surfaces, rather than a roll to create the movement. When allowing the centers of the pads to remain in contact with the instrument, increased tactile sensitivity and control of instrumentation is enhanced. The rocking motion creates the traveling movement across teeth surfaces. This motion is also responsible for the types of strokes performed. Rocking can only be done successfully when balancing upright on the fulcrum finger. Posterior instrumentation is most difficult to maintain a rocking motion, which forces clinicians to use digital or finger flexion to create strokes in these areas. All attempts should be made to limit finger flexing. In the anterior region, finger flexing is strictly not allowed.